All right, so we're going to go ahead and get started. It's exactly 12 p.m. here in Birmingham, Alabama. So we are very happy to uh, kick off our last day of the AI literacy course. Uh, Covered a lot of ground, had a lot of great lectures, and it's my pleasure to introduce Dr. Omer Awan, who's going to be concluding the course for us today. And we've got a very important topic here, AI and its changing role in healthcare, even outside of radiology. So I want to give you all the space and time you need. So Dr. Awan, please feel free to take it from here.
Thank you so much, Jordan. Really appreciate that. It's an honor to be here. AI is honestly one of my favorite topics. I think it's the future of radiology. It's the future of healthcare. And what I really want to do today is I don't want to have slides. I just want to have a discussion with you guys. And I want this to be as interactive as possible. So I would love for people to chime in on some of the questions or the comments that I'm going to say and ask. And I know you guys have dealt, this has been an amazing schedule here, diving into AI, particularly with respect to radiology, and what it's been doing, in different imaging stratospheres, even radiomics and things like that. But I kind of want to take a step back now that we're closing the course. I want to take a step back and talk about, well, what does really AI look like with respect to healthcare in general, not just radiology, but kind of taking a step back and looking at the stratosphere of healthcare and healthcare in general. So would just love to hear some thoughts about, what do you think about AI in terms of its role in healthcare? What is it going to do? How is it going to help us? Is it going to harm us? Well, what are some people's thoughts and ideas about, AI, particularly with respect to the broad general healthcare stratosphere?
Yeah, for sure. And so, like Dr. Awan was saying, this is going to be a very interactive portion of the course. So as you're able, we'd love to get your thoughts and feedback in the chat section. We also have the Q&A enabled. So anyone that has anything to share throughout the lecture, please feel free to put it into the chat. And if you'd like, I will stop my screen share here if there's anything, or if you want to share any slides.
Sure. Any comments? Anyone want to? Well, what's one way that you think it'll help in healthcare? Just, very broadly, even outside of radiology, like what's one way you feel AI is gonna? Okay, so I see AI enhancing all aspects of healthcare. All right, Cirillo, awesome. Yeah, anything more specific than that? How is it gonna enhance healthcare? Like, what's one example of that, or anyone else?
I think you can pull up like big data and create good visualization.
Yeah, yeah. Enhancing big data visualization. I like that. I mean, I think one thing that we're seeing, even in radiology, but more broader than radiology, is just being able to make better diagnoses, right? So we talk about, it's Breast Cancer Awareness Month, it's October, being able to diagnose breast cancer masses, right? Breast cancer cancers, right? Like allowing it to help us, if we're reading at the workstation, maybe AI or AI doc will detect something that we potentially didn't see, and then in fact it is a cancer. So that's one thing. From scheduling to direct patient care, yes. I mean, so there's administrative things, right? And I think that's a really big one, Cirillo. Like, the reality is that physicians, when we think about things globally, are burning out, right? Like more than 2/3 of physicians are reporting burnout. And we're just, even as radiologists, we're reading more and more studies, we're going through more and more images. It almost feels like an impossible task. And AI can potentially help with that, right? It can mitigate some of these things with burnout, even for physicians that aren't radiologists. Like, let's say you're an internal medicine, like my father is an internal medicine doctor, my brother is an internal medicine doctor. A lot of the concerns that they have, and even radiologists have, is with documentation. Well, is there a space for AI to be able to hear and record the physician patient encounter and craft a note in real time about what that encounter looks like? I mean, that would save so much time for physicians, kind of going forward in terms of, their documentation, their ability to have to write and do charting and things like that. AI can take care of that. And there are already AI platforms and softwares and solutions that do that. There's something called Regard that does that, right? So I mean, there are so many things that AI can do, even in that stratosphere, to sort of decrease some of the burnout that we're seeing. I'm using generative AI on my daily workflow with near 100% efficiency gain. Awesome. I mean, that I think that just the sky is the limit here. Talking about transcribing prescriptions. Prescription drugs is another thing. Having to fill out prescriptions for every patient that comes in. You do as you remember when you were on the floors. You check out. Patient is being discharged. We have to fill their prescriptions. Maybe write 10 prescriptions for them if they have chronic medical conditions. AI can do that for us, right? And there are softwares and capabilities now where AI can absolutely do those type of things. Answering questions, right? AI, physicians and patients have tons of questions for each other. Well, there are chatbots that allow us to answer and field those questions, right? Then also decreasing time and making things more efficient so that we can do the things that we want to do more effectively, right? Anything else? Well, what are some? So I just gave some examples. Any other things? And I know Cirillo gave some examples as well. What are other things that AI can really make a dent in healthcare for? Hallucinations are still a concerning issue. Okay. But with improved algorithms can make it better. Okay. All right. That's fair. Anyone else? Anyone besides Cirillo? Cirillo's doing a great job engaging. Would love to get some more opinions and expertise here.
I mean, is there any technology on the horizon, like the lecture we had the other day, where the radiologist sits there and then the AI can go in the background and like pull up a lot of old studies that are representative of the current study, and also like pull from the patient's history and put in the EMR? Is that in the works or not?
Yeah, I'm not sure if you're able to hear that. We
I
have
heard
a
the question. Yeah, I heard the
Oh,
question.
perfect.
I don't know if there is. Quite frankly, maybe Jordan knows better than I do, but I'm not. I'm sure they are on the horizon. You know what I mean? It doesn't sound like it's something that's that game changing, breaking that they couldn't do that. And I think that would be something that would be very beneficial, of course, for a radiologist, right? Because a lot of times we have, particularly, I'll give my example. I'm an MSK radiologist. Looking at the surgical history is often very important. If I'm doing an MRI of the knee, it's helpful to know if they've had a meniscal tear, meniscal repair, what type of repair they had. If that's automatically able to be sought after, if I'm reading and I don't have to look through Epic, then that's a huge game changer for me in terms of the time that I can save when I need to look through Epic or look through the electronic medical record, right? So that synchronization between the electronic medical record, reporting software, and dictation softwares, I think could be very beneficial for physicians and trainees when they look and evaluate this stuff. How about in education? Education is something that I'm very passionate about. I love teaching. I love education. AI, I think, has a huge. We often talk about, the clinical, and I wanted to keep this clinical, but I can't help but to talk about education as well here. AI, I think, can really, really transform education. How do you think there are some ways that AI can transform education? I invite you guys to think about call, right? So if you think about the way the radiology call is, we have, you come into the ED, you have tons of, cases that you have to get through. It's very challenging. You get tons of cases on a daily basis. You have tons of distractions. You have phone calls that are constantly happening. You have clinicians that are coming behind you. And often we try to prepare people for call, right? So we try to prepare people by doing these, simulations where we have, different cases, different complexity of cases. At University of Maryland, we have our own pre-call prep, cases that we show people. Some people, we use this some institutions use this like Indiana University, algorithm or software where they have different cases. But how can AI play a role in that type of stuff? Anu said screening protocols. Yeah, that's right. So it can streamline screening protocols to make it more efficient. One thing I was thinking about in terms of education is, can AI make a huge dent by, simulating this whole aspect of pre-call prep? So can we personalize education, right? So when we talk about precision AI and the personalization of AI and case mix, so that let's say I'm coming in and I have a whole, I'm trying to prepare myself for call, and let's say as a program director I give Cirillo 50 cases to look at, right? Like, and I'm gonna end up grading him on these 50 cases. I start with like a simple pneumothorax, and then the next case that shows up on the algorithm is like a CT scan of the item that looks for appendicitis. But Cirillo didn't catch that case of appendicitis. Well, AI can be used to tailor those 50 cases to Cirillo. So, and it has like a mix of cases so that, maybe 5 or 6 cases down the road, they'll show Cirillo a slightly easier form of appendicitis and see if he's able to get that diagnosis. And if he is, then, the algorithm will automatically refresh so that maybe 10 cases later, a slightly harder case of acute appendicitis will be shown to see if he's able to catch or diagnose that. And this way, it can kind of be personalized to one's strengths and weaknesses to be able to show and actually train that person to catch certain cases and do some teaching on the side to help him or her do it. So I think that's a huge way that AI can make a dent in education and the way we train residents and the way we get people ready for radiology call, which is a very anxiety provoking situation and also extremely important, right? Because this is the first time residents are making calls on their own. And it's a very high stakes situation where, surgical decision and things often rely on, what someone may say, overnight when there's not an attending in-house. So I think AI has a huge opportunity to do those type of things. And that's just really the education. So we talk a little bit about education, administration, clinical work. What are some of the things, and I want to just share my screen here. And I want to just share this. Let's see. Are you guys able to see my screen here? Everyone see my screen?
I'm seeing that on the Forbes page here.
Yeah, exactly. So this is, so I'm a senior contributor for Forbes in healthcare, and some of the things I write are about AI. So I actually write some articles about AI. This is one that I wrote, I think last year. Yeah, I guess last year in July. I've written several articles on it. This is just one of several that I've written. But I also want to talk about some of the limitations of AI. In general, we're keeping this general and very broad, right? So I think I'm a huge fan of AI, and I think that AI is going to transform everything that we do in radiology and in medicine. But there are limitations, and I want everyone to walk away from this course with a nice solid understanding of what some of these limitations may be. What are some limitations that people think with AI with respect to AI? And I highlight some of these in this article right here, by the way, and which I encourage you guys to read this afterwards. But what are some limitations that people may see with the use of AI or theoretically in AI? Anyone want to gesture?
Yeah, so we've had a couple of discussions so far about the risk for algorithm bias and algorithm
Good.
drift and the effect this can have on performance and potentially even worsening the existing health disparities that we have in the US and then with international deployment abroad as well.
That's a huge one. Yeah, thanks, Jordan, for that. Because I think bias is a huge problem, right? So the way a lot of AI algorithms are trained are through machine learning algorithms, and they rely on huge data sets. And as we know, all data sets are biased, right? Because no data set is perfect. So if you're using a chatbot or something if you're using like a huge machine learning algorithm to make clinical decisions on a very big topic, like let's say screening, or like let's say making a recommendation for a study or for screening studies, but that whole AI machine learning algorithm is biased towards certain patients. Let's say, the patient populations that they looked at examine mostly white or Caucasian males and females. But then we're applying that recommendation to Black Americans or, Africans that live in Africa or Asians that live in India or something. Well, that's going to be a problem, right? Because those recommendations aren't necessarily going to be pertinent or relevant to that population. And that bias that's introduced is something that becomes a problem, right? In terms of, major recommendations, healthcare recommendations that we make. So bias is a huge concern with respect to AI and machine learning algorithms. So that's a problem, right? Another problem that I think is important that I talk about here in this article is the idea of, erroneous outputs or fabrication, right? AI is not perfect. It's getting better every day, right? Because it's getting trained on more and more advanced algorithms, but it's still not perfect, right? You go to ChatGPT and you type in something, it's excellent. I mean, it's amazing. You can, it'll give you an output. It'll be very nice. And in a lot of ways, it's better than an output that I would have been able to write, even if I spent hours on it, right? But not everything is factually accurate and correct, right? So that becomes a problem because we're talking about patient care, right? The stakes are too high. It's like, let's say you're giving that algorithm to, to a machine or a chatbot to make a recommendation on your mom. Well, a mistake on your mom is unacceptable because we're dealing with people, right? So even though it could be right 95% of the time, that 5% of the time when it's not right, or it's giving you a recommendation that's not medically sound, that's going to be a problem, right? Because we're dealing with treating real people. So this fabrication, erroneous aspects is a problem, right? And I think the other thing that any other ones, I want to give one other one that I think is really important, one other limitation. We could go on limitations, but concern for patient privacy, yeah, absolutely, right? So that's a huge one. Patient privacy and cybersecurity, right? Because, it all relies on data, right? And not all data is encrypted, not all data, and sometimes data there can be breaches, and then that, we're talking about people's medical records, and this is all private, HIPAA compliant information, but how are we able to access this in a way where we're not breaching HIPAA and privacy concerns, right? And this is real people's data. So that's a huge concern for healthcare, which is why AI has sort of been somewhat delayed, in adaptation to healthcare because of some of these concerns. I think another big concern that I haven't seen yet, any other ones that I've misdiagnosis and law. Okay, good. So Anu said this. Anu was talking about, and this is something I'm going to touch on this as well. So misdiagnosis and losses related to AI misdiagnosis, and I think this relates to ethics, right? So if you look at this broader, Anu, I think we're talking about ethics, right? And there's real ethical concerns with AI, and exactly like you said. So in an example with, let's say, it didn't detect a breast cancer or something, or it detected a cancer that wasn't really there, right? Like a false positive, and that was related to AI. Well, who's responsible for that mistake, right? Are we going to, and if there's a lawsuit involved, who's getting sued? Is it the physician? Is it the hospital? Is it the AI machine? I mean, we can't sue a machine, right? So that becomes a concern, like who takes autonomy for and who takes precedence for mistakes that are done, right? So this becomes an ethical concern. Ultimately, I think the physician is the ultimate arbiter for patient care, and this is why that all AI needs to be done under the realm of physician oversight, right? That's why oversight is so key and so important in AI-related healthcare, because without, even before AI, the physician is always the arbiter for the patient, and even with AI, the physician should still be the arbiter for the patient, because ultimately it's the physician that is able to know what's right and what's not right for a patient. It's the same thing for radiology. So, ultimately, AI is not going to replace radiologists, because ultimately it's the radiologist that's making the final interpretation, right? Like we synthesize everything together and make what we think is most relevant for the patient, taking into consideration everything in terms of the patient, their history, their factors and stuff like that. So this is why, ethics becomes a big issue and a big concern with AI and the way AI is practiced. And, if you take a look, this article, kind of touches on many of this type of stuff, right? So this article talks about some of the benefits of AI, but then also, particularly with respect to chatbots, but then also talks about a lot of these concerns like bias, ethics, who's really in concern, fabrication, these type of things, right? So I think this is very relevant for this course, and I didn't want you guys to leave this course without having a very foundational understanding of AI and what it means from a broader sense, not just in radiology, but really like taking a step back and understanding what it means, and what the strengths are, what the negatives are, and then having you decide how AI can move in the future. Is there a role, do you think, for AI? I would love to just ask, in terms of for training programs, right? Because a lot of what I do is training and education. Should we, and this is great. This AI literacy course is like a bridge to training, the future generation of leaders and learners in AI. But how do you see AI maybe 10 years from now? Is AI going to be something that we are teaching everyone? Is it going to be, integrated into the curriculum? What are people's thoughts on that? What do you think about that, Jordan? And any thoughts on AI and education, and if, whether it's going to be trained or integrated in our curriculum? I mean, I applaud you for this literacy course. I think this is a step in the right direction, no doubt.
Well, I really appreciate that. Oh, I have a room full of residents in front of me, and it makes me think back to recent memory when I was studying for my boards. And I think that the big or the one of the big steps that will really bring this into front of mind for everyone will be when this is embraced as a part of as a core competency for boards and for as a key part of radiology training. But even without that motivator, I feel like anecdotally from the programs that we've connected with across the country and internationally, trainees know that this is important. This is going to be a fundamental part of their practice in the future. So I think it's going to be very important for for our boards certifying programs to embrace AI and fundamentals of AI. But at the same time, I think that our residents understand the importance of the technology and the tool as well.
Yeah, I think so too, and I agree. I think absolutely it's going to be a competency thing. I think it's a matter of time before the ACGME recognizes that this is a competency where we have to really train just the way professionalism and systems-based practice. I mean, AI, this is something that's on the horizon, I think, no doubt. It's just a matter of time before this gets integrated as a real competency, and even for the ABR, and it'd be interesting to see, 10 years from now what this looks like.
For sure. Well, Dr. Awan, I know that we are at the end of coming towards the end of your time here, and I really appreciate you joining us to be our capstone speaker for this course. If you have just a moment, I would be very interested to get your thoughts on what other specialties in medicine could maybe learn from radiology, since we've had essentially a decade-long head start on integrating AI into practice.
Really, all of them. You know what I mean? I think certainly the ones that rely on images, like pathology, cardiology, dermatology, ophthalmology, the ones that have that rely and use PACS and image-based interfaces. I think those are very important, and I think they will learn a lot of lessons from us, as we've really been the early adopters. Because there's really no other field in medicine that is impacted more by images and technology, quite frankly, than radiology. So I think those fields especially, but really all of them, right? All of them. AI is a tool, and I think other specialties are learning that AI is a tool and it's used to help us, right? So it's kind of like for us, and we've been using it to some extent for a long time, right? When we talk about CAD, computer aided detection for breast cancer diagnoses, this is kind of like a stepping stone for AI, right? We've been using this for over a decade, right? But it's kind of like it's a way, like you can tell a cardiologist that AI is kind of like using your stethoscope, right? It's like a tool that helps you listen to heart murmurs better, right? Like it's without it, it's tougher, right? So this is the same way, right? So AI is going to be used kind of as a bridge to help us do our job better, and I think this will be the case for everyone. And hopefully, with some of the examples that I gave, with decreasing the burden of administrative tasks and things like that, all specialties will benefit from the growing pains that we've sort of gone through as radiologists.